When you've opted out and you have to go into a private contract with the patient, so you have to do it properly.
What if you're opted out and you miss that automatic renewal? You're opted out for another 2 years?
You're going to be opted out for another 2 years. You have to let the patient know and have
Yeah.
them sign that you could go to a provider that is either par or non-par and get coverage. If I feel that this procedure is normally covered, then I have to do the ABN, the Advanced Beneficiary Notice. Medicare will pay 95% of their limited fee. The non-par doctor is allowed to charge 115% of that.
For somebody listening who really hasn't done a lot of medical billing, one of the more confusing aspects, and I see this being asked all the time online, is you mentioned out of network. Okay, so you mentioned non-participating, opted out, and then of course participating. So what people, let me just do this and then let me just do a little talk and then I want you to make sure I said it right. Okay. So Medicare Advantage, let's take that out of the equation. We're talking Medicare working with big medical bills and Medicare itself. A provider could have opted out, but then what they basically are is invisible to Medicare, right? So will they even process claims for that person? Or
when you've opted out and you have to go into a private contract with the patient, so you have to do it properly, only on covered procedures, not, they're coming in for pro fee. But
okay.
Anyway, when you enter a private contract, then that's saying that you, the provider, nor the beneficiary are able to file a claim with Medicare.
Okay.
You can charge your entire fee. You're not automatically put into that category, though. You do have to go through the proper steps to do it properly. And so then, yes, your private contract, you're on your own fees. The Medicare in general, you can either be in network and you get 100% of the limiting fees, or you can go as non-par, which is where most dentists are thrown into automatically. And that means you still have to go by the limiting fee. And this is where the calculation, so I'm going to put it this way. Medicare will pay 95% of their limited fee.
Okay.
The non-par doctor is allowed to charge 115% of that.
Interesting.
So it comes down to like a 9%, 9% difference when it all comes out. But you just have to do that little calculation. So you have to know where to find the limiting fee. You have to know what you can charge. So if I'm non-par, I am still limited on what I could charge a beneficiary.
Okay.
And if I feel that this procedure is normally covered, not like my pro fees, etc. There again, the sleep plans was a good example. But in your case, it's not going to be because the diagnosis is just not there for them to cover it. And then I have to do the ABN, the Advanced Beneficiary Notice. So the goal of the government is to protect our senior citizens from outrageous healthcare bills. But we as providers don't like that Medicare word. It's scary because, like you said, it's a government. But we do have to know, okay, if I am really part of the mandatory filing law and I have to send this claim, I need to know. I need to do it properly the first time. And now that you can send a dental claim, it's really not that difficult. You just have to know the diagnosis in order to put on there, on that electronic claim.
And you have to know your status too, because I've run into a lot of offices that found out they were opted out because maybe an office manager in the past, it's every 2 years, right? Is that right?
Correct. And now it's auto. It used to not be. That's why a lot don't know that providers say, I don't know, what am I? Is because it's an automatic renewal now. Unless you notify them, they'll automatically keep you in the opt out.
So what if you're opted out and you miss that automatic renewal? Is it you're opted out for another 2 years?
You're going to be opted out for another 2 years.
There's no getting around that. Okay.
Correct.
Well, that it is what it is. I mean, these are the rules we have to know.
Yeah.
So,
and I mean, it's great if you can charge your entire fee. And that might be a great position for a lot of people. But do remember, you have to let the patient know and have them sign that you could go to a provider that is either par or non-par and get coverage. So,
and now, is it true that if you are opted out and you prescribe something to the patient, that would not be covered because they basically don't recognize you as a provider? Is that, I think I read that somewhere.
That for a while was a big buzz, but who got hurt by what that was the laboratories and the pharmacies, that you would prescribe to. And so you can prescribe. That's why you're kind of automatically thrown into that non-par situation, is so that you can be an ordering and clarifying physician. But it's not as what we did go through a few years ago. Yes. They're not going to cover the pharmacy end of it.
That was a big deal. I remember that. For some reason, I want to say it started in Ohio.
Yeah, and it kind of
somewhere.
reminds me of the Medicare Advantage plans where they said, oh, well, if you're not in Medicare, then Delta or whoever is administering that claim isn't going to come. You know, how that was great for a couple of years.
Yeah, it
And
was. Well,
then, yeah, it's the same.
yeah.
Yeah.
And so that's a
Yeah.
good transition point. And I just want to make sure because, especially the people who are listening who are new to dental billing in general, this is totally Greek to them. So the dental billers see all the time is Medicare Advantage plans. All right. And so they're administered by dental billers. And if you opted out previously, this is the gray area that you were talking about. If you had opted out, then, oh my gosh, I can't even see my Delta patients and all that are, but that's not the case. The ADA, I think it was 2 years ago, I think they went to bat and made it so that CMS was like, no, you're fine for Medicare Advantage.
The newer to the dental field, the main part is those Delta Dentals or Aetnas or Cigna, whomever administer the
Yes.
Advantage plans, but it's still Medicare that's funding some of it.
Yes.
So that's where that Medicare Advantage has to at least have the same coverage as Medicare, period.
Mm-hmm.
So that, is where it got a little
Crazy.
uncertain.
Yeah. So you're doing business with Medicare by proxy, right? Through there. And the other piece is the whole fraud, waste, and abuse training,
Exactly.
that I'm sure you cover in your
Yeah.
class because it's something that the whole dental industry is like, wait a second, what? So, I mean, we're required. I mean, if you're doing Medicare Advantage through Delta, United Healthcare, whatever, participating or not, that's now what we do. So, and we can talk about that on another podcast. That's
Yeah.
like, I'll get a
And,
headache thinking
if you're
about it.
thinking about what Medicare does cover is if a senior citizen falls and breaks their jaw or there's a laceration. So there's more they cover than just the sleep services. But yeah.
Would you like to hear more? Follow the link for the full episode.